some faith-based organizations are stepping in to help address social ills in the country. Where there are gaps, churches have embarked on training their members on basic counselling service skills. These services are targeting communities and individuals at various health institutions. And today, the faith-based groups will be hosting the first national medical conference in Bronkhorstspruit outside Pretoria. And Zinoko Mhlaba is there standing by to speak to the founder of this initiative. Good morning, Zinoko.
Very good morning to you, Dudu. Yes, we'll continue giving you insights on this particular program. We're speaking to different people who are giving us insights from different perspectives. Right now, we're going to be speaking to the founder, who is the professional nurse by profession, is going to give us insights on how this program came about, especially from the health perspective. Ma'am, thank you very much for giving us your time. I understand that the program is ongoing there, but you took some time out to speak to us. Why did you see the need to bring in spirituality in this particular project? How important was it? What did you discover as a health worker?
Yes. This movement was founded on the pain that I had because I was raped as a child by my uncle. When I was doing grade 11, I was raped by my teacher. And since from then, I was a broken girl. And even if sometimes you go to church, you'll be expecting the pastor or somebody, God, to punish these people that have done this, because they'll be there singing with you, especially on my uncle's side. So that pain, I think, I grew up with, because at the end of it all, I came to a stage where my body meant nothing. This is when I started to be a prostitute. So I think I was angry, and I felt that my body means nothing. Then, as time goes on, I had a dream where I was visited by somebody who was bleeding. So, because he had holes, I took it on the hands that I took it, that is Lord Jesus Christ, who was saying, I must just live where I am. And he's shown me in the very same dream my future. And I could see that whatever that I'm doing, it's wrong. Then since from there, I think I started to study so hard so that at least I can have a place, because I was by then adopted. Then when I went to my mother's house where I was adopted, then I think my basic need was just a home to be where I can be. And after the visitation, I think spiritually, I knew myself now from the dream that whatever that I'm doing, because I was trying to get something, to get money, to survive, then I just decided that no, that's not the life. So immediately after I finished my matric, I went for nursing. But I knew that there's something bigger than what I was doing and who I was. Then immediately after that, I became an infection control coordinator in the hospital. Then, God just promoted me. Later, I became a lecturer at a TVET college. So this is where I saw young girls and boys doing exactly what I was doing. I was so touched that at the end of it all, we met up in one of the services I think it was in Kwatema.